My name is Claudia Di Bella and I am an orthopaedic surgeon based in Melbourne in Victoria. My main focus is in arthroplasty, meaning hips and knees joint replacement for arthritis, and bone and soft tissue tumours, which is a small niche of orthopaedics that treats cancers in the bones. I'm Italian and I have finished my training in Italy, and then I did my PhD, and during that time I have had a experience here in Australia for a few months, and I absolutely fell in love with Australia and Melbourne in particular. And so my journey involved moving to Australia as an IMG, which means International Medical Graduate, and then doing the entire process here in Australia to be accredited as an Australian orthopaedic surgeon. So now I'm in Australia, and certainly that move was a turning point. That brief period of time that I spent in Melbourne during my orthopaedic training and research journey was really a big turning point. I fell absolutely in love with Melbourne and its people, and so I somehow at that time I was young, and so I managed to be able to come back, and then I stayed here. In my practice, I have two fields really. On one side, there is the clinical pathway, which involves, of course, looking after patients and operating on patients. And on the other side, there is my research journey. So with regards to the clinical practice, both within the standard arthroplasty and with the bone and soft tissue tumours, there are incredibly new challenges and new fields that are incredibly exciting. And so we are talking, for example, of the development of 3D printing for the reconstruction of very complex bone defects, the ability to use robotics to really help the accuracy and precision in our joint replacement that then tends to produce perhaps some better results in some cases. And so these are really the on one side, there are challenges because they are new development, new technologies that are not necessarily yet very well established, and the results are still we're making them. And so that's the challenge on that one end. But on the other end is the excitement of being able to provide certain treatments and care that perhaps only 5 or 10 years ago was not a possibility. So on the other end, there is the research side, and from the research point of view, I'm very involved in the research within sarcoma, which once again is they are the bone and soft tissue tumours that I treat. And one of them is the research on osteosarcoma that in my lab focuses on the development of patient-specific chemotherapy treatment that can really tackle the difficulties of chemotherapy-resistant tumours. And so we are using 3D printing and 3D bioprinting to create a mini model of the tumour in the lab, so that we can then test different regimes and different combinations of chemotherapy to understand exactly what the tumour is sensitive to. So this is a step that usually is done in the patient and is clearly very toxic in these young patients, and instead we are trying to make that happen in the lab in a real time with a high throughput, meaning really quickly, so that the patients can have from the get-go the best possible treatment that is specific for them. So that's incredibly exciting. Clinically, we're seeing a few different type of trends. The first one that I really am proud of is the increasing number of women that are interested in not just orthopedic surgery, but in surgery in general. This is something that culturally and as a general concept is still quite not new, but unusual. And on one end, we've got a lot of women that go through medicine and through the learning phase, but then surgery still has that little challenge in considering, what the training means, and then what the hours and what the physical requirements are. Do it and don't listen to people that say, you're too small, you're too delicate, how are you gonna juggle family? And this is something that actually I want to touch on, which is family. And Because again, traditionally, we then take the burden of raising a family as well. And so it is not just physical, but it's also mental load of the every single day decision that we have in a family. And so one of the things that I do say to my junior surgeons who want to take this, both male and female, is having a conversation in the family about the load sharing that is agreed upon before or during the decision of creating a family, because otherwise we're asking probably too much to one single person, a woman who wants to have a career in surgery and then having to also juggle the absolute full-time job that is being a mother. One of the trends that I'm seeing and that I am very proud to be I'm very proud to push forward is inspiring more women in this part of surgery, because on one side it's certainly very doable, and me not being very strong and big, I still do very challenging surgery, so it's very doable because it's all about technique. But on the other end, it's something that everybody can do as long as we put the right passion in it, and we work hard for that, just like in any other profession. So this is a trend that I'm seeing, and it's a trend that certainly makes me very proud of. And there is a lot that is being happening at the moment within for example, the Australian Orthopaedic Association, in increasing the number of women within our society at every level, including the more leadership levels. On the other end, especially thinking about surgery, one of the trends that I'm seeing, as I was saying before, is the increase of technology within our field. Orthopedic is very technology heavy, of course, industry, and robotics and custom-made implants, 3D printed implants, 3D printed guides, they are all becoming a part of our profession. And so we certainly are training our registrars and our juniors in utilizing these new technologies in a safe way, and on the other end to understand what to do when they don't work, because of course it's not a 100% strike rate. My journey took probably a similar amount than everybody's journey, with the exception that I have completed my training in Italy, and then moving to Australia required extra few years of reaccreditation. But this is something that it would be regardless of gender, it would be simply because of a different training system. So the training is long. There is no doubt about this. From completing high school to becoming a accredited surgeon, the time is between over 10 years, 10 to 15 years. So it is a really long time studying, and it is, and you never end, you never finish learning, really. So that is something that when I talk to the junior surgeons, especially females, it's something that needs to be taken in consideration, because our career needs to be balanced with our life and family goals. And so my suggestion usually for women who want to undertake this is, first of all, follow your passions, because unless you love this job, it is really difficult to do it. So when you love it, you don't even realize it is a job. And this is a general statement. I think that it's valid for everything. But in our case in particular, we sometimes we are on call for many hours. We work many hours, and there is something that has to give. So that is something that, unless you're passionate about, would be very heavy otherwise. But on the other end, my recommendation, my recommendation is to really have that conversation with your family, and it is a journey that you take together with your partner, with your family, because there are balances that needs to be, I believe, in the family first, to then bring back to the workforce. And unfortunately, as a culture, we tend to do quite a lot within our family, and our commitments, both physical and mental, within the family can be a challenge when then your job commitments are over 10 or 12 hours a day. So there needs to be a balance there, and it's something that it's a conversation that probably needs to start in the family first, and then once that is done, it is absolutely doable, and it is a beautiful, beautiful job. It is incredibly rewarding, and talking from personal experience, when you treat sometimes young patients with bone tumors, and you really have the ability to help them going through probably the worst journey of their life, where their life is at risk, and then seeing them on the other end, perhaps with kids, having started a family themselves, is an incredible satisfaction. So the rewards are there. There is certainly need for hard work at the beginning, and it is something that it's certainly worth if you have the passion. And with regards to why that is important, for me, the real important is that we are serving a community. So as a working group, surgeons, orthopedic surgeons, our community is very diverse. And so I think that is very, very important that we are diverse just as well, because that diversity, and that has been proven multiple times with many studies, that diversity improves the outcomes of our job. So being able to listen to our patients and to address their problems in a different ways rather than just with one single point of view, it really helps in improving the outcomes of all our patients in our community. Follow your passion, because this is just like every job, really. It is a high demanding job, but it's incredibly satisfactory, and how much you can change. In my case, sometimes life when we talk about oncology, but also quality of life when we talk about an operation as simple as a hip replacement. It is incredible to see how much you can improve the quality of life of people. And so I'm not only Italian, I'm Sicilian, so certainly there is a lot of passion in that. It is that fire, we call it. We got a volcano that is the Mount Etna. It's not a mountain, but we call it the mountain, and they always say that the Sicilian passion comes from that. So there is very little doubt that everything that I do is 100% with passion. I wouldn't be able to do anything else in a different way. So passion is incredibly important for our profession. My grandma used to call it, you got a call. And I don't know if she was right or not, but it is, I think in some way, it is a call, being a doctor, being a surgeon, being an oncology surgeon, because the challenges are there, because sometimes giving bad news and knowing what will happen to that patient, for example, who has a metastatic disease, is incredibly challenging, and knowing that in some circumstances there is no power that you have to change the direction of that disease is incredibly hurtful. But that passion that you have to strive for the best possible outcome, even if it is not quantity of life, would be quality of life, for example, there is always something that you can give to give hope and to give a positive view on people in their lives. So for me, the ability to provide that connection to my community, to my patients, and the empathy that I try and always show, I find that is incredibly important. And without that, I probably wouldn't be able to do my job well or as well as I want to do it. And so I think that is an aspect of our profession that is absolutely crucial, and I believe that is crucial in every profession. But as a doctor looking after other people, it's perhaps slightly, I don't want to say slightly more important, but it's perhaps quite significant. I'm a mum, and so actually my main role is a mother. I have two beautiful kids, 10 and 12-year-olds. They are in a fantastic phase of their lives where they talk to me. They love spending time with me somehow. I know it's not going to be lasting for too long, but my passion is really my family, their sport. I used to be a professional sports person. I used to be a professional water polo player, and so sport is still very, very high in my passion. I've stopped playing only a year ago, but my kids are playing sport, and I kind of love that journey, and it feels like I'm almost back to my youth. But certainly at this moment in time, it is, staying fit and look after my family.